Hi, I'm Renee. I'm Dr. Gazelli's physician assistant and second pair of hands during surgery. You are getting ready to have a posterior lumbar decompression infusion. Today I'm going to walk you through the procedure and recovery time from start to finish. Please feel free to take notes. I'm happy to sit down face to face and go over any further questions that you have or go into more detail with you. This is not meant to be comprehensive, so I do expect that you'll have questions, but hopefully it gives you a good amount of information and background as far as the procedure and the recovery time. So initially you'll be brought back into the pre-op holding area, and the nurses there will start an IV and get things started and prepped and ready. They'll also make sure that all current medications and medical history are updated in the computer. You will meet the anesthesiologist in the pre-op holding area, and they can go over any questions you have from their end. They'll also even possibly call you the day before. So if you get a call that day before or that night before surgery from a number that you don't recognize, you may want to pick it up, because it could be that anesthesiologist just trying to get to know you a little bit and chat with you before the day of surgery. You will also see Dr. Gazelli in the pre-op holding area, and he is happy to go over any final questions at that time that you might have. As far as the approximate time of the procedure and any family expectations, typically a one-level fusion should take us about 2 to 3 hours, and a two-level fusion will take us about 3 to 4 hours. We are happy to keep whoever's with you, your family or friends there, updated during the procedure. The nurses in the operating room can call them and keep them updated, and Dr. Gazelli will come talk to them after the surgery. He'll call them, and if they're there at the hospital, he'll come meet with them face to face and discuss things with them. If they can't be at the hospital, that's okay. He's happy to call them on the phone and discuss things that way as well. So as far as what happens in the operating room, you've probably already watched the procedure video, so you know a bit about the procedure itself, but this will just recap it a little bit and go over some frequently asked questions that patients typically have. This surgery is done under general anesthesia, and we actually will have people in there monitoring your nerves during surgery. So once you're asleep, they're going to put little baby needles all over from head to foot, and that's going to be watching the nerves during the surgery. So if anything starts acting abnormally, they'll let Dr. Gazelli know right away. So I mention them and warn you about them a little bit, because if you wake up with pinpricks, bruises, and bleeding, that's what that was from, all those little needles everywhere. The incision for this surgery is typically made in the middle of your low back, and we'll move the muscles aside to get down to the spine. We do bring a microscope in if needed during the decompression around the nerve roots. And for this procedure, our focus is to decompress and take pressure off of the nerve roots, as well as to stabilize that level. So we will be removing any bone, ligament, degenerative overgrowth, disc material, anything that's pinching the nerves. We'll make sure that those nerves are freed up and happy. We'll also then remove the inside contents of the disc so that we can use that space for the fusion. And we will pack that space with some bone graft and a cage. Now the bone graft is made up of some donor bone product as well as your own local bone. So any bone that we get from your decompression, we'll crunch that up and use that as your own bone graft. Sometimes we'll even talk to you about taking a little bit of bone marrow or blood from your pelvis, and occasionally we even use a protein called BMP. We can discuss this further with you face to face, depending on which route we're going to take with you. We also put screws and rods in there to stabilize the level while the fusion is growing and the bone is growing together. So once all of this is done, the surgery is done and we can close the incision. The incision is typically closed with dissolvable stitches and layers of stitches. That top layer, I'll leave a little loop knot at the top and the bottom. It looks like clear fishing line if you or anybody sees it. So that just holds tension on the wound, and we'll trim off those little tail ends at your first post-op visit. We'll also put skin tapes or white steri strips over the incision, so you'll see those on your back most likely as well. Then a gauze bandage will cover that after we're all done closing it. Once things are done, you'll be transferred over to the recovery room, and the nurses there in the recovery room will monitor you and watch you while you're waking up. They'll help control pain that you have with medications as needed. They'll just make sure that you're waking up appropriately and getting alert enough to then be transferred over to the hospital floor. You will be staying on our spine and orthopedic floor. There are nurses and physician assistants that work on that floor regularly and know how to take care of spine and orthopedic patients. All rooms are private, so you won't be sharing a room with any other patients. We will have pain medications and muscle relaxants ordered for you for the nurses to give you as you need it. You'll also be working with physical therapists and occupational therapists while you're in the hospital. So they'll be working with daily living activities for you, getting in and out of a bed, in and out of a chair, walking, using stairs if necessary. They'll be doing all of that while you're there at the hospital. You will usually be in a gown most of the time that you're there, but you're welcome to bring any loose fit, comfortable clothing to wear, or especially to go home with when you do go home. And you're welcome to also bring any toiletries or things of that nature from home as well. So while you're there, you're going to be seeing Dr. Gazzelli or myself every day. If you're there over a weekend, you'll also see either Dr. Gazzelli, myself, or one of the other surgeons or physician assistants in our practice that is going to be on call that weekend taking care of our inpatients. So you'll see somebody from our team every day. You will be discharged home once your pain is relatively controlled and you're cleared by physical therapy and occupational therapy. You'll be sent home with a prescription of muscle relaxants and pain medications. So you'll take those at home as needed, just as you did in the hospital, and you can wean off of them as soon as you're able to. And this is also time for a reminder that we ask that you not take any anti-inflammatories for 3 months after surgery. So that means Advil, Aleve, ibuprofen, Motrin, those kind of medicines. Tylenol over the counter would be okay, but nothing else over the counter. As far as what to expect initially and the restrictions that we place on you, walking is going to be your main form of therapy for the first 3 months. I want you moving and walking in alternating positions. We don't want you bedridden or chair-ridden at all after this surgery. So even once you're home, if you're just sitting around watching TV or reading a book, please get up every 45 minutes to an hour to walk around, get a drink of water, go to the bathroom. If it's nice outside, take short little walks outside, but multiple little walks throughout the day initially. As you're feeling more up to it, you're welcome to stretch those to fewer, longer walks. We do ask that you do very little to no bending, twisting, or lifting during the first 3 months, and no other exercise other than walking. You will be given a brace to wear, and the rule of thumb with the brace is that you wear it anytime you're out of bed longer than about 5 to 10 minutes, meaning that you don't have to sleep in it. If you're getting up in the middle of the night to go to the bathroom and straight back to bed, you don't have to put it on. But once you're up for the day, sitting, standing, walking, whatever it is, you'll have that on. That gives you a little bit of support and stability, but also a good reminder not to do the bending, twisting, and lifting. As far as showers and wound care goes, you can get the incision wet in the shower, and we'll have you start showering the second day after surgery. For many of you, you'll still be in the hospital, and so you can take that first shower in the hospital there. But then when you go home as well, just shower daily. You'll take the outer gauze bandage off and get in the shower, letting that soapy water trickle down your back. Just don't let the water pound on the incision, don't scrub on it, don't soak it in a pool or a bathtub, just the trickled water from the shower. And when you're done with the shower, just pat it dry and put a new dry gauze bandage on it. There's no need for any ointments, lotions, or creams on the incision. As far as with the medications that you're taking, typically with the pain medications and some of the other stronger meds you had during the procedure, your belly can slow down and people can develop constipation. So we do recommend that as long as you're taking pain medications that you stick with a stool softener and step it up to a laxative if you really need to. Of course, stop all of that if you switch over to diarrhea. Stop all stool softeners and laxatives at that point. But typically when you're on a narcotic, a stool softener is helpful to try to limit or avoid any constipation. So for driving, we ask that you not drive as the driver for the first week or so, maybe up to your first post-op visit. And a lot of that has to do with the stronger meds during general anesthesia and during the procedure that were put into your system, and then the pain medicine that you're taking after surgery. We really don't want you behind the wheel when you've got these medications in your system. So we'll chat about that at your first post-op on clearing you to drive. With work, we typically ask that you take some time off of work, and dependent on what you do for a living will depend on how long you take off of work. You are welcome to work from home if you have that capability whenever you feel up to it and clear enough in your head. People who work an office, sedentary type job, you typically can get back to work within the first couple of weeks or so, depending on how you're feeling. And we do recommend that if you have the option of going back part days at first, whether you go back 2 weeks later, 3 weeks, 4 weeks, whenever it is, oftentimes going back for a full 8 to 10 hour day is just too much. You get too wiped out and tired from all the medications and the healing that your body is going through. So if you have that capability of going back maybe 4 to 5 hours a day and then even doing some work from home, that's usually ideal for patients. You can then do that for maybe the first week or so back to work and then increase back to full hours as you tolerate it. For those of you who have a more physically demanding job like construction workers or somebody who just has to do physical work, unfortunately you're going to be out of full duty longer. We really are going to restrict you for that first 3 months after surgery, and then we need to do physical therapy in order to strengthen your core, muscles, and to get you stronger in order to be released to do physical work. So it really can be 4 months or so before you're given full duty release. As far as any complications or things of that nature to expect, or just some normal post-op things to expect, we expect that you're going to have some incisional pain and even numbness around the incision from the skin disruption and muscle disruption. It takes about 4 to 6 weeks for soft tissues to heal. So this will be a little bit of a slow process to get all of that to dissipate, but it should get slowly better with time. Now, having said that, when we have you in a brace for 3 months, we do allow those core muscles to continue to weaken. And when they weaken, they remain sore or uncomfortable. So people can find that they have some level of back discomfort or tightness until we get them into physical therapy and strengthened up again. We also expect that you may have some nerve symptoms still after surgery. Our hope is that symptoms are much better, if not resolved after surgery. But even once we've taken the pressure off the nerves then need to heal, and they do heal slowly. So it can take weeks and even months for nerves to fully heal. However, we want things to be improved, and our expectation would be that you have less severe or less constant symptoms than you had prior to surgery. So if you have overall improving symptoms, but just a little bit of residual symptoms come and go, that's completely normal after surgery, while these nerves are in their initial healing process. Wound infections are very low typically for us. Diabetic patients do have a higher risk for infection, but even with that, usually we have a very low infection rate, and there's really a low risk of infection. We do use antibiotics during the surgery and while you're at the hospital as well. We would just ask you to keep the incision clean and dry. Again, no ointments, lotions, creams, nothing like that on it. Just keep an eye on it. And again, it's a very low chance of infection. Anytime you're doing a fusion or putting hardware in, there's always the chance of hardware failure or fusion failure. It takes a good 6 months for the fusion to really knit together and grow, and we'll monitor that. And the hardware could always fail. Maybe the bone that the hardware is in breaks or something. So we'll monitor that as well. It's typically a low risk of these hardware failures and fusion failures, but we'll watch things and monitor it with you. And because it can happen, we talk about it as a potential or possible complication. As far as when to call us, please let us know if you're having any increasing symptoms, increasing weakness, pain, numbness, tingling. Things just are getting worse and worse and not getting better. As I already mentioned, symptoms can come and go. You can have good days and bad days. Some days you just might feel your back or your leg a little bit more than others. But as long as it's overall improving and it's just up and down, that's normal. If it's escalating and getting worse and worse and not calming down, that's when we want you to contact us and let us know about it. Any persistent fevers or other signs of infection, we definitely want to know about that as well. So swelling, redness, drainage of the wound, fevers that are not coming down, things like that, definitely call us. And even persistent nausea or vomiting, let us know. We can work with medications to help you with this if necessary. As far as when you'll see us next, we'll see you back at your first post-op visit, typically 7 to 10 days after surgery. And at that visit, we'll remove any sutures or staples that were placed. We will review how you're doing overall, refill medications if needed. We'll get x-rays at that visit and go over the x-rays with you there so you can see them. We'll also hopefully clear you to drive depending on how much pain medicine you're taking at that time still. We will then see you back at 3 months after surgery, at which time we'll start some physical therapy and wean you out of the brace. We'll then see you at 6 months post-surgery and 1 year post-surgery. We do like to get x-rays every visit to monitor the hardware and monitor the fusion. And getting you back to normal. As I said, at 3 months, we'll start physical therapy and we'll give you an order for this. We'll have you start weaning out of the brace, and you can gradually increase your normal activities in conjunction with starting physical therapy. So you'll be able to start doing more bending, twisting, lifting, other activities, but just keeping in mind good body mechanics and easing your way back into things. The physical therapist can work with you on guiding you to get back into your own exercise programs, sports, or any other physical activities that you enjoy doing. And just another reminder, the fusion can take up to 6 months to heal, and we'll continue to monitor that throughout the post-op appointments. So hopefully this has given you a good amount of information about the surgery, the day of surgery, your hospital stay and recovery period. But please feel free to call or email us at any time should you have any other questions or concerns. Thank you.